Problems and challenges of COVID-19 quarantines in Nepal. In Nepal, COVID-19 disease infection reported first time on March 23rd, 2020. A Nepalese student returned from Wuhan, China, and 76 students returned on charter plane from Wuhan, China on March 19, 2020 by Nepal government, which were put first quarantine for 14 days, established in Bhaktapur Kharipati NEC Training Center from March 19, 2020 to April 1, 2020 for 14 days. The quarantine it temporarily used was well managed, but after 14 days all quarantined persons were released home since no symptoms were observed in anyone and swab test samples also shown all negative results. The student from China whose swab test resulted positive was put in isolation in Teku Sukraraj Infectious Disease Control Hospital for further treatments of COVID-19. In this way, number of infections of COVID-19 increased day by day. The Nepal government imposed country lockdown from March 24, 2020 onwards to the till date. Today, March 31st, 2020, infected people number is 1,19,192 are in quarantine and 1,349 are in isolation, and the infected are 1,567, and the deaths are 8 people, and the total recovery up to today is 220 people. Within the period of lockdown, 68 days, so many quarantines were established in different places of the country. In the western terai regions, many temporary set quarantines were made by military sections, and many colleges, school buildings, office buildings, and factories were made quarantine to put the newly returned from India through entry junctions border areas. The number of entry people from India to return home to Nepal are unlimited every day from the border centers, Gaurifanta, Gaddachauki, Sunauli, Baki, Dadildura, Saptari, Siraj, Thori, Birganj, Danakpur, Kakarbitar, Jogbani, etc. Border entry from India to Nepal were made strict, but the public voice raised to allow entry to armed citizens and was done as per the voices of the people by the government. Support needy people were distributed charity supplies, food, soap, and sanitizers through the local bodies. Many social groups are working to help the needy ones day by day. The media also giving the information about the condition of quarantines every day. The medical kits of COVID-19 virus infection checkups and lab test materials PPE, which were purchased from China by G2G process on leadership of Nepal Army, and the supply was too late to reach the country, and Chinese government also offered many kits to Nepal government. PCR and RC tests are being done by the government in a very slow way to check the infection of the COVID-19. The condition of the quarantine later established in terai areas and the western part of Nepal are not in proper condition that the basic needs and infrastructures are not managed in those places. There are so many challenges to work as a good quarantine rules. There is lack of test kits, medical staffs, security persons, insufficient and unhealthy food supplies, insecure feeling of quarantine people, and lack of sanitary services, cleanliness. Physical distancing is completely neglected. That in a room more than 20 people are put in quarantine rooms and made a big crowd of 1,000 quarantine persons. Every day new persons are sent to the quarantine, crowding it. The challenges and problems of quarantine are seen directly, and sanitary maintenance, water supply, laboratory facilities, food supplies, and medical test facilities are very poor. Entry and exit gates are open, no compound walls, fences, unfriendly environment, medical staffs are not present, and due to the medical tests done late and irregular, many quarantine people are expired by untimely medical treatments and food supplies. Now the voices reporting that the quarantine home become the center of infection of COVID-19. Government and local bodies are not giving serious attention to upgrade the quality of the quarantine services. Even though these challenges are seen, the uncountable number of people are returning home to Nepal from India, Kuwait, Malaysia, many other countries by self-walking or by government charter planes that are all quarantined for 14 days. The situation is getting worse every day due to COVID-19 lockdown procedures to prevent the spread of the disease.
The government of Nepal has to pay a very serious attention to improve the facilities and qualities of the quarantines urgently. The isolation centers should be immediately established in a well management by the government efforts to take care of the health of the citizens is the government's responsibility. Unlimited budget, that is 10 billion Nepalese rupees, has been claimed by government that the government spent for coronavirus infection control management. There is no transparency, no work of it. The citizens and experts asking the detailed expenses of that amount. No satisfaction expressed by all people. So in this way the government will soon give a clearance of all these budgets. Thank you so much.
After watching this video, you press and like and share this video to your friends, and finally subscribe my channel Panyangu Creations. Thank you.